Hello and welcome. I'm Natalie Giacondo, President of MPN Advocacy and Education International. For those of you who are new to us, we provide educational programming, support, and advocacy for the MPN community. After today's presentation on navigating MPN resources, we'll have some questions and answers. So if you have any questions, just type them into the chat and we'll get them answered for you afterwards. We are so pleased to welcome Jennifer Dunn, Nurse Navigator, to Dr. Brandy Reeves, who joined us earlier this week to discuss polycythemia vera. If you weren't able to catch that discussion, you can check it out on our website, mpnadvocacy.com, or on our YouTube channel. Jennifer Dunn, Nurse Navigator, is part of the MPN group at the University of North Carolina, Chapel Hill. And thank you so much for joining us. We're really excited to hear what you have to tell us today about MPN resources.
Thank you for having me. As I've been in kind of the navigating the MPN world for the last 2 years, I've learned that I'm actually very lucky to be an MPN navigator. There's not many of us around, so I love teaching and I love making sure patients have everything that they need to successfully get through this. So
Wonderful. Thank you so much. Our patients love to get the information, so I'm going to leave it to you, and afterwards we'll do some questions.
All right, great. I'm going to share my screen here.
Thank you.
I don't want my entire screen. Hold on one second. Sorry, it's been a little while since I've done a Zoom, so it just takes me a minute. And I lost it. Sorry, I promise I'll get this right in just a minute.
No problem.
Share screen. I want a window. I want the window, I think. Let me know if you can see this, because I used to be really good at this.
Well, we don't see it yet.
Aha.
Okay, there you go. Now we see it.
Oh, perfect. Okay, great. So yeah, I'm Jen Dunn. I have been a nurse off and on for, well, not off and on. I've been a nurse for 18 years now, and have loved every minute of it. So I'm really happy to be here. Most of my time has been at UNC in different roles, which I'll kind of get into. Just kind of wanted to introduce myself a little bit to, so you guys know who you're talking to. Again, nurse for 18 years. I've done a little bit of everything in hematology oncology world. I've done inpatient, outpatient, everything there is to do with clinical trials. I was a nurse educator for pharma. I did some patient assistant programs that I directed, and I've been a nurse navigator a couple times now. So got married about a year and a half ago. And if you know anything about me, I love dogs. I am the mom to 2, which are outside right now and not very happy about it. And I just love to do things, axe throwing, bowling, anything like that, just to kind of, and go to Vegas, because, who doesn't love to go to Vegas? So my objectives today are to basically kind of explain what I do, and because I am lucky enough to be part of an entire team, kind of what all of our pieces do and how we fit together. I want to make sure that you guys have the resources available to get accurate and reliable information about your diseases. And I also want to make sure that you guys know financial resources that are available as well, because we know these drugs are not cheap. So at UNC, like I said, I'm very lucky. Our model, we have 3 providers. I have 2 MDs, Dr. Van Devender and Dr. Reeves, and 1 nurse practitioner, Becky Sawchuk. They're all wonderful and super knowledgeable. We have a clinical pharmacy provider, Shelley, who is fantastic. She makes sure that the patients have all their education when it comes to medications, She'll usually meet with you before you start medicine to make sure you know the side effects, what to look for, how often are we going to do labs, all that stuff. If it's an injectable, either she or I will teach you how to do those injections. We want to make sure you're successful. And she makes sure that when she sees those labs, she will make recommendations on how do we need to adjust this? Do we need to go up in a dose? Do we need to go down in a dose? She helps with appeals when we need her, and she will help us write infusion orders when we need it as well. So she's can't do anything without her. My job, sorry.
Jennifer, you know what? We can't see, we just see the main slide. So if you go to slideshow and then we'll see the ones that you're on. So we're just seeing the very first page.
Oh, I'm so sorry.
No problem. I just want to let you know. There you go.
Okay. All right. Sorry. Okay. So I am the nurse navigator. I tell patients my job title is a perfect one because I navigate patients. I am their main point of contact. I'm the hub and the wheel. I kind of make sure everything else goes around and goes where it's supposed to go. I make sure patients are scheduled for their procedures and their appointments for treatment. Again, I do injection training, which I love to do. If you are being referred to us and you're going back to your local oncologist, I'm going to make sure that they have all of our information and they have all of our suggestions. And if you're going to go back and forth, making sure that when you come see us, we have all of their notes and just making sure that your care between two offices is as smooth as possible. I assist our MAP team when I need to, and I'll explain what that is. I triage your symptoms, and I may be the one to answer back, or I may send this to my providers and go, well, what do I need to tell them? And then I'm always in clinic when my providers are in clinic to make sure that if patients need anything, I'm right there that I can go in and help. We have 2 intake coordinators who basically, they do everything referral wise. They make sure that they get all the referrals and that they're appropriate to come to us. They make sure that you guys get scheduled in a timely manner, and that we have all the records. And then if we're going to refer you out anywhere, they're also the ones that make sure that that happens as well. And then probably one of our most important people, don't tell anybody else that, is our MAP person, Willette, who she works with the insurance companies and the grant associations. If you get your medicine approved and it's a zero copay, that's her. And that is only her. And she is amazing. And that's my team. So I love working with them. They make my life a lot easier and they make my job fun. So let's talk about resources. I always tell patients WebMD is the devil. Please do not go there. Don't just Google. I have an MPN, what now? There are some really, really good websites out there. Obviously, this one that you guys are on now, the MPN Advocacy and Education International Group. MPN Research Foundation is really good too. The Insight, who makes one of the drugs that we'll talk about later, they have one called Voices of MPN, which is a really great source as well. PV Reporters rate one to kind of help you track your symptoms and helps you kind of bring information to the appointment that we need to know. You may have had a week of flushing, 3 weeks ago. And when you come see us, you may have forgotten that. And that might have been important for us to know. And if you've got all your symptoms written down, then we can go through that and we know it. Clinicaltrials.gov is always great because you know what's going on out there. If you're interested in joining a clinical trial, it kind of tells you what's out there for MPN patients and where they are. So, Leukemia Lymphoma Society has some good information, but really trying to stay with these organizations that are going to give you really accurate and really reliable information, because a lot of times patients go down rabbit holes and they're not good rabbit holes. And so sometimes we are fighting that information to help treat you better. And so, if you have the right information, it just makes everything so much easier and so much more successful.
Jennifer, is it possible to make that particular slide bigger by, I think you would go to slideshow and from current slide there. I think if you press on that to the left, it'll make it so that it's your whole screen. No,
Okay,
or maybe not.
not that.
Maybe try from the beginning. Just a little troubleshooting here, just to make that bigger.
Sure.
One of our watchers has asked to see that a little bit bigger, and it's just a small
Sure.
version.
Are you seeing, because I had it on whole screen before and you weren't able to see the.
Okay. I'm still seeing it the same way. So
Are you able to, by the zoom on the bottom right-hand corner, that you know how you can see the different types of
there you go.
views?
That's too far. Let's see.
If you go to the furthest one, yeah, that one, click on that and see if that does anything.
How did that do?
I think you have to zoom out still.
Yeah,
It's not letting-
tech troubles.
Okay. I know. So sorry.
No worries.
So are you seeing anything right now or just that small screen still?
We're seeing the small screen and sort of one part of it blown up. Oh, that's a little bit better.
Yeah, so I don't know. I'm just not quite sure why it's not behaving.
All right. Well, let's do the best we can then. We can always, if it's okay with you, share these slides afterwards if anybody has questions. Okay, great. That would help.
Yeah, I was actually going to provide my email address. So if anybody wanted the slides, you know, I'm happy to share them. That's kind of why I made sure to put all the links there so that everybody who had the slides could just hit that link and go straight to it.
Wonderful. Okay, go ahead. We'll let you keep going then.
All right, thanks. So sorry. So let's get to kind of sometimes the more important stuff. How are these drugs getting paid for? Like I said, I used to manage and direct patient assistance programs. So I'm kind of lucky and I can see behind the curtain and I know how the wizard works. Every company that manufactures a medication is going to have some assistance until it's too old of a drug. And then a lot of times we don't get them, i.e. Pegasus or peg interferon. But the rest of them, they'll have copay cards. They have manufacturer assistance programs. What that means is if you don't have commercial insurance, you've got Medicare or government insurance like TRICARE. Your insurance covered the drug, but it's $5,000 a month. Well, that's not reasonable. That's not something everybody can just afford every day. And so that's where copay cards come in. And a lot of times once you exhaust a copay card, then you apply for manufacturer assistance to try to help pick that up. Sometimes your insurance company denies the prior authorization, they deny the appeals, and we have to go that route, manufacturer assistance, to get you the drug. And a lot of times it's at a very, very reduced price, or it can be free. But there's very strict guidelines on how that works. And I'll go into that a little bit more in my next slide. But just so you know that those resources are out there. If you're lucky enough to go somewhere that they have a Willette who does this every day, they know to go for those and look for them. If you're kind of struggling on your own, just know that those are out there. And typically for copay cards, if you have commercial insurance, it's very easy to apply for them and, you know, get them. And then you just, whatever specialty pharmacy is going to be distributing or shipping you your drug, just make sure that they have that card number. For us, we make sure that they have it. But if you don't have a whole team, you know, just make sure that they have it and they'll use it to get rid of that copay for you. And so there are places that provide grants for our patients that either they've gone through their copay, they are traveling long distances and they need help with gas or parking vouchers or, you know, anything like that. They don't have insurance at all. A lot of times that's where manufacturer assistance will take place as well. But there are different places out there that you can go that will offer support. Some of it's very limited. Some of it's very generous. And unfortunately, in the world that we live in today, most places are at the mercy of how much funding that they have available. And so, once that funding is gone, then if you hear my dog in the background, I'm sorry. Once that funding is gone, then it's kind of that grant is closed until more funding becomes available. But we do have, obviously, if one's closed, then we go to another one. And again, we have somebody who's very good at knowing what's closed, knowing where to go, and where to get you approved. Most grants, in particular, are they're income based, and they're disease based. So I know, like Leukemia Lymphoma Society, they do different copay assistance programs for leukemia patients versus MPN versus lymphoma versus myeloma. And most grants and most medication assistance programs, they're going to look at what's called the FPL, and that's the federal poverty level percentage. What percentage are you above that level? And how they do that, we do what's called a soft credit check. Well, I don't, but I used to. And basically, it just kind of looks at what was your last year's income tax or your taxes, and how many people are in your household. And they take that information, calculate FPL, and say, okay, yes, we can give them assistance. No, we can't. They make too much money, which stinks because the drugs still cost a lot of money, whether you make a lot of money or not. But just kind of knowing that that's what they're going to look for. And when they ask those questions, we're not being nosy. We're just really trying to get as much support as we can. A little tip that most patients don't know, but I do because I was there. If you apply for medication assistance programs, in particular with a pharmaceutical company, and if they deny you because you made too much money, and yeah, last year you did great. You and your partner it was wonderful, but now you've gotten sick and maybe you've had to stop work. Maybe they've had to stop work or cut back hours because they're taking you here and there. So your income now, when you need the drug, is drastically different. You can ask, if you've been denied, to have it appealed. You have to ask the medication assistance program directly. And you can say, I want to appeal this because, this X, Y, and Z has changed. And most places will allow you to do that. They won't tell you that you're allowed to do that. You have to ask. But a lot of times they will allow that to happen. So just a little tip. And last but not least, I love helping patients, whether they're mine or not. So here's my contact information. Feel free to email me if you're somewhere and you want to come see our group for another opinion. Have your physician email this group email. We set it up specifically for that reason. It includes all of us in one neat little place. And so, they can always send us the information. So, and I know I said 15 minutes and I'm at 18, but that's it.
Thank you so much, Jennifer. Though that was amazing information, especially the part about that little tip you gave about appealing.
Mm-hmm.
That's really valuable, and I'm sure that some people here today will benefit from that information. There's so much that you shared.
Yeah, sorry.
No problem. That's wonderful. Are there any questions? Does anyone watching today have any questions specific to MPN resources, navigating those resources, potentially navigating your healthcare team? Something I thought about is, you were speaking specifically to what you guys do there at the University of North Carolina in your group. Mm-hmm. Does every group have a nurse navigator?
I wish. Now, with UNC, we do. And like our leukemia group actually has 2 nurse navigators. Our myeloma group has 2. So especially with our hematological malignancy groups, they have at least 1 or 2, except for MPN. Hi, I'm it. And then in our solid tumor side, almost every group has a nurse navigator as well.
So if I live outside of that area though, and I'm going somewhere that's not UNC, and
Mhm.
I may or may not have a nurse navigator, who plays that role if there is no nurse navigator? Who takes that on?
Typically, in most like small offices or offices without that, that's going to be your office nurse. Your physician's nurse is going to be the one that's probably doing the PAs and triaging calls and doing all of that information. I know when I'm coordinating information, a lot of times that's who I'm always asking for is the physician's nurse and talking to them and trying to get everything done.
And I wasn't clear, thank you, by the way, for that answer.
Mhm.
But I wasn't clear. So you are helping people to navigate these systems and also dealing are you also, you said you're triaging, so you're still
Mhm.
taking symptoms and having those conversations about symptoms
Mhm.
with patients.
Yeah, absolutely.
You can answer questions not just about navigating those systems, but also symptom related type questions and
Mhm.
okay, I understand. Good. Perfect.
Absolutely, yeah. In fact, a lot of my calls are that, and I really don't. I'm lucky in that I have what's called a hybrid position. So if I'm not in clinic, I'm at home, and so I don't have like a direct phone number. My patients will tell you if they send me a MyChart message, which is the system that we have for sending emails to your providers. I'm usually answering them back within 30 minutes. So
Wow.
yeah. And so that system has been wonderful because it's so easy for me to have that up and going all day. Sometimes I have it on my phone at night. To say, hey Jen, I'm not feeling great. I'm running a fever. Or hey Jen, it's been a week or two. I haven't heard anything about this new medicine. Where are we with that? And different things. And so that's so much easier. If not, then they'll track me down somewhere. And we also have a triage nurse that will handle calls a lot of times first.
Okay.
And if she can't handle the symptoms, then she'll send them to us.
Gotcha. Okay. So I've got a couple of questions here just to follow up with what you just said, though. So if there are people who are not part of the UNC system and they have
Mhm.
questions, is that information that you gave, and of course we'll share these slides with whoever attended today, something they can call and ask you questions even though you're not part of their
Oh, yeah, absolutely. Yeah, I don't mind helping patients at all, like I said, whether they're mine or not. Um, and so, yeah, absolutely. My email address is there. Please feel free to send me an email and say, hey, Jen, what's this? Or, anything, how do I get to this financial place and things like that? Absolutely.
Thank you. That's incredibly kind. And there's some hearts coming up on the screen. Appreciate that. Okay, so I have a question from one of our viewers. One Blood in Orlando is now charging polycythemia vera patients $100 for phlebotomies. Is there a resource to help patients to pay for phlebotomies?
I wish there was. If there is one, I have not heard of it yet. One Blood was my go-to because we have them up here as well. I was very disheartened when I heard that they were now starting to charge $100 because a lot of times for my patients that didn't live near us, that was always such an easy thing to do. There is still, I believe, the Blood Connection will do them for free. Um, American Red Cross, not in North Carolina, will do them as well at a lot of their blood donation centers. So that's kind of where I tell patients to start is to call a local blood donation center and ask them, hey, do you do therapeutic phlebotomies? And if so, what do you need from me? What do you need from the provider?
Okay. All right, good. So the Blood Connection, American Red Cross might do it if it's in your state or local blood donation centers
Mm-hmm.
to do therapeutic.
Phlebotomy, yeah.
Okay,
A lot of times like if your local hospital has a walk-in lab, sometimes they'll do them in there. I have a couple patients that do that as well. So there are other options. It just may take a little creativity to get it done.
gotcha. Do we have any other questions for Nurse Navigator Jennifer Dunn about any financial questions about how to access resources? Again, symptom questions, I guess you could probably navigate some of that. And
Mhm.
To do that, you would just go ahead and push the Q&A button at the bottom of your screen and type that in. I'm just going to give it a second to see if we have any other questions coming up. And again, we're going to share these resources with you. So if you think of something after today's webinar, you can always reach out directly. Thank you again for making yourself available.
Absolutely.
Oh, here's another question. Are there sites where patients can connect with other patients?
Oh, absolutely. A lot of those sites that I showed for the medical information do have support groups, online support groups. I know for, like Voices of PV, yeah, I can't remember what it called it now, but the Voices one is a good one. Leukemia Lymphoma Society usually has a different network of support groups or online support groups. But yeah, I think, I would go kind of just investigate, but a lot of them do have different support groups available. Sometimes Facebook has some that are good. So you can find them. And if you can't, let me know and I will find them for you.
Okay, great. Thank you. And it's probably good to mention that we have just started our patient support group this week. So we had an online patient support group on Monday, and it was fairly well attended and had a really nice, robust conversation just about some experiences of sort of isolation and those kind of things. So if you would like to join our patient support group, the information for that is at mpnadvocacy.com, and you'll also see some things coming from us in your email. So I've got a couple other questions here. Any good dermatological resources for PV patients with itching rashes?
Oh, that's such a bad one. It's such a struggle with that. One of my physicians has like a list that he provides patients. It's tough, because a lot of times it's either shower related or different things, and you can't just say, well, don't take a shower. I mean, it's you can't do that. Really, we just have to kind of, number one, if we can find a medication that's going to help, with your MPN, it's going to help with the symptoms and the itching. If not, we start with creams. There's different bath products you can use and different things like that. One of which, ask me and I will give you directions on how to do it. I'm just not gonna, yeah. And so, there are like little things that we can do. Unfortunately, I don't know of anything that is super, super helpful other than getting that MPN under control and, alleviating the symptoms that way.
Okay, so if you have questions about that special bath routine, you can reach out to Jennifer privately. Okay, I have another question. My husband's doctor wants to start him on momelotinib, but our insurance company has denied it. What is our next step?
If they've only denied the prior authorization, then the next step is going to be appeal. Most insurance companies will allow 1 to 2 appeals. Sometimes they will allow a peer-to-peer. So it's really up to whoever is handling that in the doctor's office to ask the insurance company, okay, you've denied the prior authorization, what's next? And then they start that process. A lot of times the manufacturers have little appeal template letters already pre-started, and it's, you just got to fill in the information, so it's a little bit easier on offices. But yeah, usually just the first no is never no, period. And a lot of times I've seen where we've appealed and gotten it approved after that first appeal.
Okay, great. Good to know. All right, my MPN team and Health Unlocked are sites where patients can connect with other patients. Oh, okay. So someone has
Thanks.
information about that. So again, my MPN team and Health Unlocked are sites where patients can connect with other patients.
I'm going to make a note of that.
Are you aware of a limit on the copay card? I just started Jakafi and copay was $1,900. It is covered, I'm concerned that I'll probably be on it for a long time. I'm sorry, a lifetime.
Mhm. So yes, there are a lot of times limits on the copay cards. I don't have at my fingertips what each one is, but they all do have them. And that's when, if you max that out before the year's over, that's when we're going for the medication assistance. We're looking at grants and things like that to help assist and pick that up until we can roll it over again next year.
Okay, so each card has its own limit.
Yeah.
They all
Mhm.
each do have a limit.
But they most do have a limit of some sort. Some of them are very high and you never reach that limit. Some of them are not, and you reach it pretty quick, and that's when we have to kind of get into gear. Most specialty pharmacies are good at letting us know that the patient is going to be exhausting their copay card so that we can, get ahead of it. If they don't, and you know that your copay card is going to be getting close very soon, let your providers know so that they can start tapping into those other resources.
Okay. Such good information. All right, let's see. I think unless we have some more questions, I'm so happy that people are feeling that they can type into that question and answer box down at the bottom and
Like,
get some questions answered. And again, so thankful that you've made yourself available offline and after this webinar to answer additional questions that could come up.
absolutely.
I think that may be the end of our questions for today. So we will go ahead and wrap things up. And oh, nope, I'm not right. I see. Someone has shared some information about some Facebook groups where they
Mm-hmm.
contact patient to patient. And so I will share that information with people who are here today. We'll send something out with your slides and some of this other information. So thank you so much to the person who shared that with us.
Yeah, thank you.
So again, I just wanted to thank you. Oh, I'm getting more questions, so I might want to. Oh, even more information about Facebook groups. Perfect, perfect. Thank you so much to the person who's sharing that. Thank you again, Jennifer, for joining us. And thank you to the, oh, can you take Ojara and Jackify?
Um, that's more for a question for my provider, who I know is lurking in here. I'm trying to remember. We have put Ojara with other medications. I'm just not sure if Jakafi is one of them. I think that would definitely be a conversation to have with your physician. Because they are both JAK inhibitors, I don't know what the benefit of both would be, but at the same time, I can't say for sure yes or no. Sorry. That's more of a pharmacy question. Sorry.
That's okay. It's good to know, what you're able to answer and what you're not. And thank you to the person who asked that question. And it sounds like they need to ask their pharmacist.
Absolutely. Yeah. Ask the pharmacist, talk to your physician if that's something that you want to do. Mm-hmm.
I'm on Pegasus, and Pharma does have funding for this medication. Not
Hmm.
sure. Oh, okay. So they're on. Also, I am on Pegasus, and Pharma does have funding
Oh,
for.
good. Okay. I asked my map person, and I tried to do some digging on their websites for it, and it was not something I could find easily. So kudos if you have found it. That's great, and please share with me because I know where it is as well.
I see. Pharma and is the name. Okay.
Pharma.
So I'll get more
Okay.
information about that to share as
All right.
well.
Great.
I hate to end it because I'm concerned that we're going to get some other questions as soon as I do. So I'm going to just wait a moment and make sure
Sure.
that we have
Absolutely.
all of our questions answered. Anybody else has any questions? Now is your chance to ask Nurse Navigator Jennifer Dunn. Ah, I see. What advice do you give to newly diagnosed patients?
Ask a lot of questions. Definitely go to the sites, go to the reputable sites. Make sure that you have your questions. Make sure you bring somebody with you when you go to the doctors, especially if you're newly diagnosed or just walking in and getting that diagnosis. You're going to get glazed over because it's a lot coming at you. And so make sure you have somebody with you who can kind of be a record keeper for you, and who can maybe remember those, again, if you have questions, make sure that you kind of bring them with you. That's always helpful. And then definitely, there's good websites that will have here's the questions to ask your provider when you go. And so that kind of helps you oh, I didn't even think of that. But, I think that's kind of when you're first diagnosed, you're getting information overload. And a lot of times patients are afraid to ask questions because they think that they're being a pain on, to us or whatever. You're not being a pain. We'd rather you ask questions and get the correct information than not ask the questions and get incorrect. So questions, ask questions. Again, we're going to give you a lot of information. We don't expect you to absorb it all at one time. You're going to be like, hey, I think I remember you saying something about this, but there was a lot.
Good point. Okay, so ask questions and don't be afraid to ask follow-up questions,
Exactly.
more questions. Okay, good.
And bring somebody with you. That's hugely important. I had a friend that got diagnosed with cervical cancer, and so I went with her just because I could be that person that was just writing everything down, and then I would take the notes and type them all up and send them to her so she knew how everything went. So
That's a really good idea, actually, having someone type it up and send it to you afterwards. So thanks for sharing that. Okay, I think we are going to wrap up now for sure. And I would like to thank you again for sharing with us today, and just would like to thank all of the MPN specialists that present at these webinars. They do that in their own time. They are completely volunteer, and they do that because they want to share the information that they have that can help you and to answer your questions. And so we want to thank them. Also, I just want to mention that we have some upcoming events. Friday, June 7th, we'll be hosting an event for our patients who are living in India. So Dr. Bose is going to be talking to and about answering questions for any patients who are living in India. Also, Monday, June 10th, we'll be speaking with Dr. Michelle Corey and Dr. Kristen Pettit about MPN and women's issues. And Thursday, June 20th, you can join Justin Grinnell and myself for our Healthy Summer series, where we're going to be doing some exercises, yoga, and meditation. And of course, if you are in North Carolina or around that area and you'd like to join us for our in-person event, we'll be hosting that on Thursday, August 22nd in Asheville. So thank you again for everybody who joined us today. If you have any questions, you can reach out to Jennifer Dunn. We'll share that information with you. Myself, Mallory Tim, or Ann Brazo, and you can find our information on mpnadvocacy.com under leadership. So I appreciate your time today, and I hope you all have a wonderful rest of your week. Thank you.
Thank you.